follow-up care is actually just as important or more important as the prenatal care, because a lot of things that exist with women in terms of disease processes, they actually can get worse after they deliver, specifically preeclampsia. So you may have a lady who has just borderline elevated high blood pressure, and then it develops into preeclampsia. Maybe we see it when she's in the hospital, but a lot of times ladies are coming back a week or two later because they had a seizure at home. So it's important for us as physicians to let our patients know that they need to make sure they're coming back postpartum so that we can monitor things like if they had diabetes, if they had high blood pressures, if they had vaginal repair, and we need to check on how that repair is doing. The other thing that's important for women postpartum is that there's a high incidence of postpartum depression. And those things need to be treated if they're still in place after 6 weeks. A lot of ladies either feel guilty about talking about it, or they are trying to kind of gut it out and take it and deal with it themselves. But depression is a medical condition. And if you need to get treatment medically with either therapy or medication, that's something that we need to address. And not as many women really come in for that postpartum evaluation, so that we can make sure though that we are taking care continually to keep them in good health.
Traditionally women deliver babies, we take care of them in pregnancy, and then we kind of just let them be after the baby is born. In certain cultures, there is definitely a community where people surround women who had a baby and take care of them and the baby. And I think that's so important. And we need to get back to that, and we need to support that in the healthcare arena.
So what we want to ensure is that not only do they have proper prenatal care, but once they do deliver, that they're able to maintain their health status in order to be to create successful families for our communities. So hypertension and diabetes are some of those conditions that can develop during pregnancy, and we would call those gestational at that time. But they do have the ability to become chronic, meaning they persist past the 6-week postpartum period and require future follow-up and treatment from a primary care physician or even a specialist. The barrier that precludes women from actually getting that care sometimes is actually insurance coverage. And when we start talking about insurance coverage, specifically Medicaid, we are fighting for Medicaid expansion because we are finding that our mothers do not have access to care while not pregnant. And some of these chronic medical conditions are not treated adequately.
I really want us to advocate and support the Momnibus, which is a piece of legislation in Congress that's been championed by U.S. House Representative Alma Adams of North Carolina and Lauren Underwood of Illinois. And this legislation is a 12-piece bill that puts into place things to support moms during pregnancy and after pregnancy. It's very important, I think, and will help us improve postpartum care for Black women.